Lesson 9. Applying acupressure to treat pain of the 7th cranial nerve. Facial paralysis without weakness on one side of the body occurs due to peripheral injury of the 7th cranial nerve. There are many causes of facial paralysis and mouth distortion, but 70% are usually due to sudden exposure to cold. People with peripheral 7th nerve paralysis often experience symptoms after waking up in the morning, such as numbness on one side of the face, reduced sensation, weakness of the facial muscles on one side, inability to fully close the eye, deviation of the philtrum, mouth distortion, difficulty speaking, and food or drink spilling while eating. The patient needs to be taken to the nearest medical facility so that specialized doctors can examine and rule out other causes of facial paralysis such as trauma, compressive tumors, herpes zoster, or viral infections in order to receive timely treatment. First, we use an herbal pouch to apply warm compresses to the paralyzed side of the face. Before acupressure, we need to disinfect and warm our hands. Pressing the following 15 acupoints will help support the treatment of peripheral facial paralysis right at home. The first is the Yangbai acupoint. The Yangbai acupoint is located on the forehead, identified by measuring about 1 kan above the center of the eyebrow along the gallbladder meridian. Press the Yangbai acupoint by using your index finger or thumb to press perpendicularly. The Yangbai acupoint is effective for treating eye pain, eye diseases, improving vision, treating facial paralysis, headaches, and forehead pain. It also dispels wind, clears heat, and promotes the flow of qi. Second is the Yuyao acupoint. The Yuyao acupoint is the depression in the middle of the eyebrow, directly above the pupil. Yuyao is an extraordinary acupoint. Press the Yuyao acupoint by using your index finger or thumb to press perpendicularly. The Yuyao acupoint is effective for treating myopia, conjunctivitis, facial paralysis, orbital neuralgia, and pterygium. Third is the Zanzu acupoint. Zanzu is located at the depression at the beginning of the eyebrow, belongs to the bladder meridian, and is effective for treating headaches, eye fatigue, improving vision, and facial paralysis. When pressing the Zanzu point, use your thumb or index finger and apply pressure in the direction toward the top of the head. Fourth is the Jingming acupoint. The Jingming point is located in the depression, just in front of the inner corner of the eye. Jingming belongs to the bladder meridian and is effective for brightening the pupils and treating eye diseases. When pressing the Jingming point, use your index finger or thumb, directing the force toward each other to form a V shape. Fifth is the Sijukong acupoint. The Sijukong point is the depression at the end of the eyebrow and belongs to the triple burner meridian. When pressing the earlobe, do not use your index finger or thumb to press in the direction of the force towards the opposite ear. The Sijukong point is effective for treating headaches and eye diseases. It dispels wind, relieves pain, clears heat, reduces internal heat, and regulates the qi of the triple burner. Sixth is the Chenki acupoint. The Chenki point is located in the depression between the lower edge of the eye socket, directly below the pupil, and belongs to the stomach meridian. When pressing, use your index finger or thumb to place on the acupoint, directing the pressure downward toward the foot. The Chenki acupoint is effective in treating tearing when exposed to wind, controlling tearing in dacry or cystitis, treating conjunctivitis, myopia, hyperopia, optic neuritis, optic nerve atrophy, dispelling wind and clearing heat, and relieving facial neuralgia. Seventh is the Sibai acupoint. The Sibai acupoint is a depression located directly below the Chenki point, about 1 kan down along the stomach meridian. When pressing, use your index finger to press perpendicularly. The Sibai acupoint helps brighten the eyes, treats facial paralysis, facial neuralgia, headaches, dispels wind and clears heat. Eighth is the Yingxiang acupoint. The Yingxiang point is located at the intersection of the horizontal line of the nostril and the nasolabial groove. The Yingxiang acupoint belongs to the large intestine meridian and is effective in treating nasal diseases and clearing nasal passages. When pressing the Yingxiang point, use your index finger to massage and press at the spot with the pressure slightly angled toward the cheekbone. Ninth is the Daikang point. The Daikang point is located near the mouth, about 0.4 kan from the corner of the mouth, identified at the intersection of the nasolabial groove and the horizontal line extending from the corner of the mouth, and it belongs to the stomach meridian. When pressing the Daikang point, use your index or middle finger to press both sides simultaneously, applying force in a V-shaped direction. The Daikang point is effective for treating facial paralysis, trigeminal neuralgia, facial nerve pain, drooling, dispelling wind pathogens, and relieving qi stagnation. 10th is the Jiache point. The Jiache point is located on both cheeks, above and in front of the angle of the lower jawbone. To locate it, clench your teeth tightly. The spot where the muscle bulges is the position of the point. Use your index finger, thumb, or middle finger to press on the point, massage the area, and apply pressure inward toward the jaw. The Jiache point belongs to the stomach meridian and is effective for treating toothache, jaw joint pain, otitis media, facial paralysis, poor digestion, bloating, and belching. 11th is the Renjong point. The Renjong point is located on the upper third of the philtrum groove and belongs to the due meridian. The Renjong point is effective for treating mouth distortion, upper lip twitching, calming the mind, dispelling wind pathogens, benefiting the back and spine, quickly clearing heat, and regulating rebellious QI. When pressing, we use the index finger or thumb to press perpendicularly. 12 is the Tingwei point. The Tingwei point is the depression in the groove in front of the ear canal, located just below the Tingong point and belongs to the gallbladder meridian. When pressing the Tinghui point, use your index or middle finger to place on the point, pressing inward toward the ear. The Tingwei point is effective for treating tinnitus, deafness, otitis media, facial paralysis, and temporomandibular joint inflammation. 13 is the Tingong point. The Tingong point is the depression located right in the middle of the groove in front of the tragus and belongs to the small intestine meridian. When pressing, we use the index or middle finger, open the mouth, place the finger on the acupoint, and press inward toward the ear. The Tingong point is effective for treating tinnitus, deafness, otitis media, otitis externa, calming the mind, and treating facial paralysis. 14 is the Ermine point. The Ermine point is the depression in front of the ear, just above the Tingong point, and belongs to the Sanjiao meridian. When pressing, use the index or middle finger, place it on the acupoint, and press inward toward the ear. The Ermine point is effective for treating tinnitus, deafness, otitis media, dispelling pathogenic heat, unblocking QI, and treating facial paralysis. 15th is the Hegu point. The Hegu point is located on the hand and belongs to the large intestine meridian. To locate it, bring the thumb and index finger together. The point is at the highest spot on the muscle between the thumb and index finger. When pressing the point, place your thumb above the point and your index finger below it and massage and press at the spot. The Hegu point is effective in treating numbness and pain in the fingers, as well as paralysis of the hand and arm. Hegu is one of the 6 main points used to treat conditions in the head and face area, such as headaches, toothaches, trigeminal neuralgia, temporomandibular joint inflammation, and tonsillitis. Note, do not press the Hegu point on pregnant women. For each acupoint, we should press slowly, hold and massage for 10 seconds, then release slowly and repeat 10 times. Do this regularly every day. 3 important notes when performing home care. First, when massaging, always stroke upwards, never downwards. Second, consistently massage and press the acupoints for 15 to 20 minutes each day. Third, it is recommended to chew gum frequently on the paralyzed side to help the chewing and biting muscles recover.